On behalf of Clark University's Gryphon Pleiades Honor Society, I'd like to welcome you to our first ever Leadership Conference. Gryphon Pleiades is an honor society dedicated to promoting scholarship, citizenship, and leadership on the Clark campus and throughout our local Worcester community. The theme of this year's conference is sustainable leadership, which will be explored at both the individual and community level. We believe that a true leader demonstrates qualities that mobilize others into action. The conference is designed to equip students and anybody else with the skills and knowledge that will empower them to become leaders in their groups, organization, and community. Firstly, I'd like to thank Student Leadership and Programming, Student Council, Speakers Forum, and Face Aids for the contribution to help fund this event today. All the money that we'll be getting from this conference is actually going towards a scholarship to a rising senior. So somebody in the junior class at Clark University that really, displays leadership, citizenship, and scholarship in, their life, during their life and career at Clark. So I'm gonna let Amelia come up and she's gonna introduce our keynote speaker. Thank you.
Thank you, Crystal. It is my great honor to introduce our keynote speaker, Donna Barry. Donna is currently the Advocacy and Policy Director at Partners in Health, and PIH works with partner organizations and ministries of health to provide quality and dignified health care in 12 countries around the world, including Russia, Rwanda, Haiti, and the United States. As Advocacy and Policy Director, Donna is guiding efforts related to health and hunger, socioeconomic development in Haiti, increasing the pool of funding for global health and health system strengthening. Previously, Donna led Partners in Health's project to treat multi-drug resistance tuberculosis in Russia and was co-director of PIH's women's health programs in Haiti. A nurse practitioner with certification in women's health, Donna also supports Partners in Health's nursing activities and provides clinical and program advice to PIH's women's health programs. She's here today at Clark to speak about sustainable leadership in the global community in regards to challenging the status quo in global health. Following Donna's talk, there will be an opportunity for questions from the audience. So please help me welcome Donna Barry.
Thanks so much, Amelia and Crystal, and thank you so much for having me here today. I really appreciate it. What a beautiful, beautiful day and a beautiful, beautiful view you get to look at while I'm up here. So this was I was just telling Amelia and Siobhan, this was a talk that I really had to sort of think through and try to come up with some things to share with you. It's really easy for me to stand up here and talk about what I've been doing for the last 10 years, but how to tie that to leadership and to the conference theme. I've been kind of struggling with it in my head for the few weeks since I was asked to do it, as Amelia knows, because I kept pounding her with questions. I hope, what I'm just going to do is walk through some stories about some leaders that I've had the opportunity to work with and work for, and talk about some of their characteristics, and also, a little bit more about the work that Partners in Health does, and a little bit about the work that I've done throughout my career. So hopefully that'll sort of come together in a cohesive whole, and then we can have a discussion afterwards. And, I just want to start by saying, obviously, there's a lot of, probably every single person in this room is a leader already. You're here on a Saturday, you could be in bed, you could be, I don't know, maybe doing homework, but then that would still make you kind of a leader on a Saturday morning. For the commitment that you have to be here, and clearly those of you who are in the Honor Society also are showing, great leadership qualities already. You're going to have the opportunity to hear from and talk to a lot more really interesting people this afternoon. I just met one of them right now, and I know Sam Baker, and some of the folks you guys are going to have an opportunity to talk to today. It's going to be really enriching, and it's going to be exciting. And so take advantage of it, pepper everybody with questions, get their cards, talk to them, and enjoy and learn. Okay, so first slide. So I should have put the state up there without the name on it and said, who knows what state this is. But you probably wonder why I'm talking about global health and Nebraska. However, it's somewhat interesting. First of all, my sister is here in the audience with her fiance, and we both grew up in Nebraska. And so it's been quite a trip in my life and her life too, to get engaged in some of the work that we do, coming from an incredibly rural small town in Nebraska. And the other reasons why that's connected is because one of the articles that Amelia shared with me to do a little prep for today was actually from a conference that was held on sustainable leadership in Omaha, Nebraska, where I guess there's a big hub of sustainable leadership thinkers. Who knew? And then lastly, completely out of the blue, I get an email from another sister of ours this week that's got a bunch of slides from a webinar that her husband had participated in about leadership and leadership qualities. And the reason why they sent it to me was because Paul Farmer was mentioned in those slides, and we thought of it, and so it sort of all fit together. But the other reason, one of the first points I want to make is that our whole lives are spent, developing, right? I didn't quite think I was going to get to my 40s when I was 20 and still be learning and still be trying to figure out how to be a good manager, how to be a good leader. So we have to sort of take things from everywhere that we can. And where you grew up and the experiences that you have are part of your life forever, and there's something that you can build on. And remember back to those times and all the things that you learned. I was hanging out with my neighbors last night who have 6-month-old twins, and they're just so adorable. And I was talking to the dad, and he was saying, he's like, boy, kids just, they remind you about how innocent we start, how sweet we start, and you're just completely ready to learn, and that's what we all need to be our whole lives, honestly. It's like to have that vulnerability to learn and to experience, and also to have that openness. The other person up there has nothing to do with Nebraska, but he's actually here at Clark, and I don't know his official title. I should, but it's Bill Fisher or William Fisher, who's a professor here at Clark, and I had him teach as a professor over 20 years ago at Columbia, and he was one of the first professors that made me cry. He was one of the first professors who really challenged me. As far as why do I want to get involved in global health? Why do I want to get involved in development? His scholarship has been very complementary to all the work that we do at Partners in Health. And as far as why are we doing what we're doing? Are we not maybe exerting too much external influence over the countries that we're working in? Are we listening enough to the people that we're working with? And so I just wanted to put a picture up there of him, because I would not be where I am without Bill Fisher. So, 1, remember where you're from. 2, take advantage of the amazing professors and faculty and others that you come across in your lives who are amazing leaders in their own right. Okay, next. So this is actually something I stole this week, although I did attribute it from the person who gave the talk to this group of health statistics folks in Nebraska. It's from Sanjeev Chopra, and he came up with this mnemonic, which I spelled wrong, didn't I? To list some of the qualities of good leaders. And I just wanted to talk about a couple of them and some of the folks that I've learned from in my life. So listening. I think there's nothing more important when you get into a new situation than to listen. I think that, it's oftentimes we walk into a room and we think we're the most important person in the room, and we, particularly if you're in another country or something, and you're like, oh, I'm here to teach you, or oh, I'm here to share my knowledge with you. I think a lot of the programs that we've developed in the United States for young people are very much about that. Peace Corps is where you're going over and working in a community, and you're there as a teacher oftentimes. You're there as someone to share knowledge. And I think it's so critical that when you're in these situations, the very first thing you do is listen. Our former COO and Chief Program Officer at Partners in Health, he came to the organization probably a few years after I started. It was a new job, and we were all a little suspicious. He didn't have any experience in global health whatsoever, and we sort of thought he was going to come in and be a grumpy boss and take charge of everything. He didn't barely utter a word for about the first 4 months that he was there. He sat in meetings, he soaked it all up, he listened, he watched, he paid attention. And that's, I think, one of the most critical things that you can do when you're coming into a new situation or throughout your whole life. I'm not going to talk about all of them. Empathy, I think, is also, and humility, I think, are also incredibly critical leadership traits and perhaps skills. But, you know, they go very much with the listening, in that when you're listening, you need to listen empathetically, not just sympathetically, but empathetically, really trying to understand where the person who you're speaking with is coming from. It's not easy, and it's almost, I would say, probably impossible for, you know, one of us to go down to a rural village in Haiti or Vietnam and listen and really truly understand the experience of someone who's living there. We've got so much more advantage, but if you try with the empathy, with the humility of someone who's there to really try to be a leader, it's more possible. I think dreaming big and sense of purpose are incredibly related as well, and I'll talk a little bit more about this towards the end and throughout my talk, but you know, we all have good ideas. We all have big ideas, and there's going to be a lot of people in your lives who are going to tell you that they're crazy ideas, and they're not feasible ideas. So, oh yeah, that's a great idea, but it's just not possible. If that were the case, with all the people, with all the social change that's been made over the last, progress that's been made over the last 50, 60 years, we would still, be in a segregated society. We wouldn't have brought down poverty by 50% over the last 20 years. Things like that. So we have to have the dreamers. Don't let people squash those ideas, those dreams. Those are the most important things that can lead to change and are really important for leaders. All right, let's go to the next one. So the first couple of people I want to talk about today, one you might recognize, one you might not, are Dave Ryan and Barbara Bush. And they are a couple of the founders of an organization called the Global Health Corps. And Dave was also one of the original leaders of FaceAIDs. And Dave and Barbara approached us, and Katie Bullock, who was there as well, approached us probably about 5 or 6 years ago, with this idea that they wanted to have a new organization. Something Peace Corps-like, but not quite, and not just for healthcare professionals, but they wanted these leaders who joined the organization, or as fellows, to become good leaders. They wanted them also to they wanted to be part of health systems, but not just clinicians. And so they just published a piece this week, which was also incredibly timely for my talk, and I'm going to quote it a couple times. But the first thing I wanted to read that they wrote was, "We believe that the global health leader of the future is not necessarily a doctor or a nurse. The complexity and scope of today's challenges require people with diverse skill sets from a range of fields. The global health leader of the future will, however, be an innovator, a mobilizer, and a servant, committed to partnership and learning by reaching across borders and sectors." So a lot of the students that recent students and young people, you have to be under 30 to apply, that they take in as fellows, and it's gone from 20 fellows just a few years ago to they're recruiting for a class of 110 this year. So it's an amazing story of a new organization that's really, really growing. But the thing that appealed to us most about what these young people set out to do was that they didn't want to just send students from here to poor countries and to do work. They wanted to engage young people in those countries themselves to also do the work so that they're doing together. So in every project that they work in overseas, there's someone from either here or Europe who's there as a fellow, and they are matched up with someone from that country as well, who's also someone who wants to be part of the health system. And they also bring a bunch of students from other countries over here to be fellows. And we have some at our PAC project in Boston, there's some in New York, there's some in New Jersey, I think there's some out in California now with the mental health program. So they do it's really giving an opportunity not just to young people from here, but also to young people in other countries. And like I said, most of them actually none of them are clinicians because they're straight out of school. But many of them are, development majors, anthropology majors, English majors, history majors, business majors, things like this. And so they're really going in and working on our supply systems. They're going in and working on training things and having a huge impact in the projects where they're located. But an incredibly committed group of people, they themselves, I think, still all under 30, who are doing amazing, amazing work at engaging their peers in working around the world. Okay, next one. So, here's some folks you might also recognize. I didn't tell you my whole story, but I had been working in global health for a while and decided that I wanted to become a clinician. So I went back to school and did my nursing and nurse practitioner degrees. And that's what brought me to Boston. And at that time, this was about 15 or so years ago, not quite 12, I was finishing up school. I had worked in Russia previously, but I really wanted to be a women's health nurse practitioner. I really wanted to be a clinician. And I had a very open last semester because I had already done a couple master's degrees, and so while my other classmates were stuck in fairly boring classroom work, I had the opportunity, and a friend drugged me literally to hear Paul Farmer and speak, because they were just starting the program in Russia. And she said, "Oh, it'll be really interesting, it'll be really exciting, you gotta go hear this guy." So I went and heard, and it was fine. I mean, it was great, but it was, whatever. And then she said, "Go talk to him, go talk to him." And I was like, "Why?" And she's like, because, maybe you can, help them somehow. You speak Russian, they're starting a program there, nobody there speaks Russian probably. So I went down, introduced myself, and then he introduced me to our medical director, who's still our medical director, now Chief Medical Officer, Joy Mukherjee. And then, she and I connected a little while later, and she said, "Well, you really have to meet Jim Kim, because he's the one who knows the most about the project. He's the one who's kind of running it right now. So let me set up a time for you to meet with him." So it took like 3 or 4 times, multiple times. Our little meeting was canceled because he was a very important man, and he still is. But I finally got in there. It was like April of that last semester, and I was already thinking about taking boards. I was looking for jobs already, as a clinician. And he said, "So when can you start?" After like 10 minutes of discussion, he said, "When can you start?" And I said, "Well, I have plenty of time right now, and these are my class times, and, I'm going to be a little busy studying for my boards, but I'm happy to give you some more time." He's like, "No, actually, we want to hire you." And I was like, that's not what I was planning on, actually. I wanted to be a women's health nurse practitioner. And he said, "Oh, there'll be time for that, but we really need you here right now." So I took the job, and it's been an amazing, amazing 10 years that I've been there, and learned so much from these guys. They're an unlikely crew of leaders when you look at some of their beginnings. Jim, who's now, if you don't know, the president of the World Bank, grew up in Iowa. And son of a dentist, an immigrant from South Korea, grew up in a small town in Iowa, was the only Asian kid in the community, went to Brownlow and has always had intellectual curiosity and intellectual thirst, and it took him then meeting Paul at med school at Harvard to try to really help direct some of what he wanted to do at that time. Paul also grew up in incredibly humble beginnings down in Florida and other places in the South. If you've read Mountains Beyond Mountains, you'll know that, they lived in buses, they lived on boats, their dad kind of took them all over the place. And, but he also had the opportunity to go to Duke as an undergrad. And it was there during one of his summers that, he went down to, I forget why he went down, but he went down, he was down in Florida, and he was like doing crop picking with Haitian immigrants, or probably undocumented immigrants at the time, and that started his passion with working with Haiti and with working. And so it was a lot of sort of little things that surprisingly happened to bring these folks together. Ophelia Dahl, you may know, is actually the daughter of someone fairly famous, Roald Dahl, but she also didn't have to, was not directed to this work, except for her father insisted that she take a gap year between high school and college, and what she wanted to figure out what she wanted to do. And she ended up in Haiti, and she ran into Paul. And it was nothing was planned, right? Nothing was planned. None of these guys planned to meet in their lives. They didn't come together because they all knew at that moment in their life that they wanted to do something to help change the world or make it better. It was a lot of fate that was involved. But they all had those different qualities, leadership qualities, taking them in directions that somehow they managed to meet one another. And I was lucky enough to fall in it as well. And I've been incredibly pleased and honored to be part of this work for so long. You know, so Partners in Health, if you're not familiar with the organization, we've been around for like 25 years. We're not big compared to some of the other big global NGOs out there, but we've had an incredible impact. And I think that's because we've got some leadership that dreams really big and doesn't let people say no. So when I first started there, we were working on the tuberculosis project in Russia, and we'd already started working with drug-resistant TB in Haiti and in Peru. And at the time, there were people at all of the U.S. agencies involved with global health, at the World Health Organization, at the World Bank, at all the decision-making bodies who basically said you cannot treat drug-resistant TB in poor countries. It's too complicated, it's too expensive, they don't know how to do it, and so basically everyone who was diagnosed with it at that time in a poor country was sentenced to die. There's no other way around it. And everyone seemed, at the leadership of all of these entities, were fine with that. And Paul was not fine with that, and Jim was not fine with that. And so thus began our quest to really try to change the policies in these entities and to find the funding to do this work. And we did. And it wasn't, we didn't have a flip chart up on the wall that said, change policy here, have a meeting there. It was definitely a lot of different pieces of the party, but most importantly, it was the clinical work on the ground with our brothers and sisters in these countries to cure these patients. Then it was documenting that, writing research papers about it, and publishing it so that people could say, oh, actually, I guess you can treat this disease in a poor country. Who'd have thought? And then it was going to those policy levels to really try to change the policy. And now it's done everywhere. There's no question that it can be done. It can't, and no one's saying, oh, you shouldn't be doing it. And so it's thinking big. We can change the system. We can make a difference. We can save lives. We did the same thing with HIV. I think it's probably, we're far enough away from this, unfortunately, like 15 years later, where it's not really a story anymore. But when the first medications came out in the United States and Europe to treat AIDS, no one thought, where the vast majority of the burden of disease was not here, was not in Europe. It was in Africa already. There were millions and millions of people who were infected. And everyone here said, too expensive, too complicated, they don't know how to tell time, they wouldn't be able to take their pills on time, we can't do it. Same thing, we treated the patients in the field, we published papers to show that it's possible, and as did some other organizations. And now there are, I think 8 million patients on ARVs around the world. In the course of like 10 years, we've been able to get that many patients on treatment. I think another astounding thing is that we just published a paper in December to show that the percentage of patients that we're able to keep on treatment in Rwanda, so in an incredibly poor part of the country, in an incredibly poor country, is we're keeping patients on treatment, at least for the first year, at 86%. The average in the United States is about 33%. So it's what you can do when you dream big, when you care about the poor, when you work in concert with the poor, is absolutely amazing. Okay, let's move on to the next one. Oh, I guess I have plenty to say, huh? Okay. I was worried I didn't really have anything to say there, sorry. So, I think one of the best parts about working at Partners in Health and what I've been able to do with my career at Partners in Health is to meet the amazing people who work with us in the field, leaders themselves. But I think it's important to note that we always, at Partners in Health, have had a mission to develop the leadership in the countries where we're working. There are very few Americans that work at our sites. It's really about developing the capability of the folks who are there to do the work themselves. And we always work within the public sector at this point. We're not building our own private clinics to set them up outside of a system. They are all, at this moment, part of all the public health systems in the main countries that we work in. Fernay, who's in the orange shirt, is our clinical director in Haiti. He's been with the organization for over 20 years as well. He has stuck with us through thick and thin, through coups, through times when we weren't able to be down there to support them at all. And he's actually now at the School of Public Health at Harvard working on getting his master's so that he can continue to develop his leadership skills. He is more O for the P, as we say at Partners in Health, operates with an option for the poor than anyone I've ever met in my life. A child of privilege when he grew up in Port-au-Prince, but knew that what the big needs were in his country, and has dedicated his life to helping make lives better for everyone there. On the top side there, on your right, are two of our nurses and midwives from our teams down in Haiti at Partners in Health clinics. Both also who've had incredibly long tenures. I think they've both been there at least since I've started, so around 12 years ago. I think they've probably been there for 15. Always had the opportunity to go work in a private clinic and serve wealthier patients in Port-au-Prince. There are more Haitian doctors working in the United States than there are in Haiti. And I bet that is probably the same for nurses and midwives as well. But these are women who have dedicated themselves to working in some of the worst conditions in the country to be there and to work and to serve those patients. On the bottom, in the front, is Dr. Hinsati, who is our program country director in Lesotho. Hind herself is Sudanese. She went to medical school in Russia, as many Africans did back in the 80s and 90s as part of our little Cold War plotting out who's taken over the continent. She has led that project with an iron fist, but also with the compassion that I've never seen. We are doing things there that no one's ever done in Lesotho, let alone many places in southern Africa. We're treating MDR-TB with incredibly good, with multi-drug resistant TB with incredibly good outcomes. She has started a maternal mortality program at these incredibly remote mountainous clinics out in the middle of nowhere, where if a woman has complications, we literally have to fly them out so that they can get the emergency care that they need. But saving lives like nobody else, and really integrated also into our research work to try to spread the model. And this is what I think leadership is so much about, is really helping develop the leaders in the countries, those leaders who are going to stay there. Those leaders who are going to continue to come up with amazing ideas and continue to build on what we've been able to do in other countries. Next. So you can't really see folks in this picture very well, but I just wanted to talk a little bit about some of the other things that Partners in Health is engaged in that we see as part of developing other leaders in global health. And I actually want to say that you're going to hear a lot about it this afternoon, but you don't have to, I'm not saying this all just for global health projects. There is a lot of need in our own country for good leaders and good service providers and good folks, and a lot of problems that we have here that are just as intractable as they are in other countries. And so I want you to always think that I'm not just saying that I'm including us in the globe. How about that? That we all need to be working here and there. So a couple things. I just want to talk about some of the interns in our internship program, some of the partner organizations that we work with, and also a new program that we started at Partners in Health called PIH Engage. So we've had an internship program, formal and informal, at PIH for a long, long time. But we've really formalized it over the last 5 years. And before I get too much into the details, unfortunately, we're not having it this year. We're doing a lot of restructuring in the organization, and we don't have a person who can manage the acceptance process as well as the program over the summer. So I'll talk about it now, but apply next year. Okay. We got over 700 applicants last year for like 25 positions. So it's a ton of work to really trying to manage that process. And so, unfortunately, we're not doing it this year, but we've had incredible kids come through it and young adults. So just a couple of them in this photo. Sorry, hold on. So, you won't be able to see them anyway, but one of the young women in there is on staff with us right now. She came in as an intern, and she started working as on our development team, and is now actually working really closely with the development team and our team in Haiti to raise funding for the new hospital that we just built in Haiti. Another young man in that photo, Isaac, worked for our program in Boston for the last, I think, like 4 years, and was an integral part of their team and their research team and some of their development work as well. He just moved on to a position in New York, but is an absolute amazing leader. And Max, the only person of color you can see in the back there, he worked with our Haiti team in Boston. He spent a little bit of time with us in Haiti working there as well. He's Haitian American, but most excitingly, he was just a regional field director for the Obama campaign in Florida, and was absolutely critical in helping win that campaign down there. And is just an up-and-coming, amazing leader. And we're so pleased to have everyone in that picture has a role to play in the world. But those are the three I'm most familiar with 5 years later, who've really been doing amazing, amazing things. The green organizations over there, I won't talk about each one of them individually, but they're either campus groups that are doing amazing work and really helping us with the movement building part of what we do. And I know many of you are probably engaged in some of those activities right now. A couple of the other ones are actually projects in other countries that PIH is not working in, but that have sort of come through medical school, and been taught by Paul and by Jim and by others, and have started their own projects in a couple cases in countries where they've come from themselves. But so Tia Time works in Liberia. Project Muso is working in Mali, even in the midst of all of the unrest there right now. Their project is still going. One of my former interns actually is there working for them right now as a fellow. And Village Health Works is a project in Burundi of an amazing young man, Deo, who also sort of came to this work through being familiar with us and with what we do. And PIH Engage, so it's a new entity. Siobhan and Amelia are both here and both very involved in it here in the Worcester community. But what we're really trying to do, and John Schaefer, who's helping lead the efforts from Partners in Healthside, is really trying to engage people in the United States more in supporting what we do. It's a community engagement process that's tailored mostly to fundraising at this point, and activism, and also just learning about the issues, learning about the problems themselves. And so it's tied very closely with the work that I do in the advocacy and policy world, and I would encourage you all, if you're not part of it, to talk to those two and sign up and join us. And it's not an intensive level of work at this point, I don't think, only for probably you guys and John, but it's another way that you can sort of get engaged if you're interested. If you're not, that's okay too. Okay, next. Okay, so one of the last things I want to focus on are some of the people who are, some of the gaps in the leadership that we have in the world, both domestically and globally. And women are some of the best leaders we have in the world, but are a minority by far of leadership in this world, whether it's here or in globally. But some of the best leadership we have comes from women, and I should have had a picture of Mary Robinson up there, the former president of Ireland, who also is one of the most inspiring leaders I've ever met in my life, and who has gone from working on her issues in Ireland to being a great global ambassador for human rights and climate change and women in general. But Secretary Clinton just resigned yesterday, unfortunately. She has done remarkable work, and who knows where she's going next. But I have to say that she has gotten us through so much over the last 4 years that's gone unnoticed. That's it's the daily grind. Everybody's heard about how many trips she's made and how many countries she's visited, and how much she's been on the road. But she is a true leader, and I hope that she'll be able to now do more leadership. I of course want to pull her more into global health, but we'll see where she ends up going. On the lower right-hand side is our global nursing director, or our chief nursing officer now, Sheila Davis, who is one of the most humble, amazing people I've ever met in my life. But that also leads into another thing I wanted to talk about, which was different professions that are that have leadership roles in global health. The vast majority of them are doctors. And the vast majority of the work is actually done by nurses. And you know, I was asked, I think a couple years ago, to give a talk at UMass nursing program in Boston and about nursing in global leadership roles, and there are none. And it really put me and some of us at Partners in Health on the track to really make sure that we were both strengthening the leadership of the nurses that we work with in the countries, but also just advocating for the role of nursing around the world and in roles. If you look even at, if you look at our Center for Disease Control, the NIH, and then you look at the World Health Organization, except in those departments that are specifically devoted to nursing, there is no nursing in leadership, and it's got to change. I'll just leave it at that. But we need people from other roles than simply medicine to be leading these departments and to be really sharing the wealth of experience that they have. Next. So, I don't know if you guys saw this story. Probably didn't. If you're not friends with me on Facebook, you probably did. But if you followed the One campaign, you did. This is President Joyce Banda from what country? Who knows? Malawi. Yep. Who has an incredible story to tell of leadership and of leading her country now. But Joyce Banda was the vice president of Malawi until about a little over a year ago. But she herself rose from a poor village in Malawi, got an education, started a small business, became a sort of multiple small business owner, immediately started channeling profits into a nonprofit to help more girls be able to go to school, became a leader in her political party in Malawi. I'm telling a really long story short, and is incredibly and almost died from giving childbirth from one of her children because of the conditions of medical care in Malawi. She was probably almost not president. We don't know all the details, but when she was vice president, the president decided he didn't want her really to be vice president any longer, and wanted his brother to be in leadership, and there were assassination attempts on her life. And she was thrown out of the party. But she had an incredible base of support here in the United States, particularly from Secretary Clinton and groups like us, who knew what an amazing woman she was. So luckily her life was spared, and then when the president died last year, there was also 48 hours of she's either going to come out on top or she's going to be dead. There was no question in our minds. She survived. So they've had some really tough economic times. The president had completely ruined the economy, they've had serious currency devaluation over the last couple of years, or since she's become president, so that they can sort of balance out the economy. However, what she just decided to do was sell the presidential plane, which is worth, I forget now, a lot of money. I don't know how much jets cost, but I don't know, hundreds of millions of dollars maybe, something like that. Because the president just bought it 3 years ago for hundreds of millions of dollars when their economy was in, the dumps. And she's decided that she's going to sell the presidential plane. If she needs to take a plane ride, they can get a charter. And she wants to rechannel that money into poverty alleviation projects in Malawi. But talk about an inspirational figure. Talk about somebody who came from, incredibly difficult circumstances, has lived through incredibly difficult circumstances, and is spending all of her time as president right now trying to help everyone else in her country who is in difficult circumstances. Okay, next, and we're almost done because now there's not going to be time for questions. Okay, so I had the incredible honor of also working on the president's re-election campaign this past summer and fall. I took a leave of absence from Partners in Health since we're 501c3 and we can't be engaged in political activities. Have to say that, and worked up in New Hampshire for about 4 months on the campaign. mostly because I think our president is an incredibly inspirational leader, and because I firmly believe in what he accomplished in the first term and what he's going to attempt to accomplish in the second term. But I guess the reason why I wanted to pull that in was, one, it was in the description of the talk, so I thought I should address it a little bit, but I'm happy to answer more questions about it. But two, I really wanted to share that, so much of the skills that I've learned at Partners in Health or in my other positions were immediately applicable to campaign stuff. And also, I learned a ton on the campaign that I'm now applying in my work at Partners in Health through using social media and involving, famous people and using the media, like the press, to advance our work. I got into working on politics incredibly late in my life. The first campaign I ever worked on was the governor's campaign in 2006. And I don't know how many of you guys did any volunteering last year? Anybody? Interesting. Do it. It doesn't have to be for Democrat. It doesn't have to be for an independent. It doesn't have to be for a Republican. Get engaged. Get involved. And you'll learn so much and benefit from it so much. And help change the world in that way as well. Okay. I think the last slide maybe. Okay. So I just want to close with two things. I wanted to just list off a couple things that I hope I mentioned in my talk. Remember where you're from. Make sure you learn from everyone you're around. Listen. Listen to everyone that you encounter. And especially listen to those whose voices are rarely heard. Find your inspiration and share it with everyone you come across. Follow good leaders and make sure you hire good leaders. And follow your heart and your soul and use your brain a little bit on the side. And make sure you take chances. And I think the most important thing I wanted to reiterate is thinking those big thoughts, right? I think that without those big thoughts and using them to improve the lot of impoverished or working on a social justice issue, every single one of us working on that can help make things better for other people. I was going to throw a whole bunch of quotes in from different, inspiring leaders and that sort of thing. And, this talk that I had pulled, those 10 leadership qualities, or however many leaders spells out, I think it's 10, had quotes from all sorts of different people, all men, by the way. However, every single one of them was working on a social cause. There are very few, and it's not to say that we don't need them, but there's very few inspirational quotes that come from really wealthy people in the world. It's mostly people who are fighting for justice, whether it's Martin Luther King, Gandhi, Mandela, or Paul Farmer. It's people who are really fighting the fight to make things better for other people. Okay, so the last thing I'm going to do is read one last thing from Dave and Barbara, and it's from the Global Health Corps folks. So, the global health leader of the future will be a servant. She will stand with and learn from those she seeks to serve. She will recognize the privilege that it is to serve those in need. Her top priority will be delivering results. And we believe the most inspiring, life-changing service experiences are those that achieve real results. We are inspired not when we see a problem, but when we're able to contribute to solving it. The global health leader of the future will thrive when placed in a position to serve. So thank you very much, and let's talk for a little bit. Sorry, I didn't give so much time.
If anyone has a question, I have a microphone. Or you can just talk with the microphone to a scary.
Thank you for a nice presentation. My question is, a lot of the places that these projects are being offered, they have political systems that are really either corrupt or unstable. So how do you channel all these resources that ensure that all these resources will go to the projects that you're offering in those fields.
Where are you from?
Ghana.
Ghana? Okay. So, oftentimes we work at a more of a regional level than channeling things through say national and federal systems. But that's not to say that we're not encouraging big donors and stuff to really try to be channeling their big resources through the federal system so that we can help build up their capacity to manage those funds. You're right that many of the places that we work in have had difficult political transitions and etc. But I think in all of them it's getting more and more democratic and more transparent. But what I wanted to, when I started, when I said that what we mostly do is work on a regional level or a local level, is that it's people both in those positions in healthcare, both like if you're a healthcare commissioner and you're sort of, what if you want to call it, a county or something like that, that don't change positions nearly as often as governments do. And so it's those folks that we find to be some of our best allies and people that we can do the work with. And, unfortunately, there's been part of what Global Health Corps has been trying to deal with. There's a dearth of sort of mid-level professionals in a lot of countries where we work. There's not a lot of accountants. There's not a lot of lawyers. There's not a lot of people there to help you manage grants and to help manage especially the big grants that the big donors are giving. And so what we've really been trying to do is help develop the capacity, both in those places and sort of on the local level, but also really trying to push for that at ministerial level places like ministries of health, ministries of finance, ministries of other, environment and things like that, where they work, because it's bureaucrats, they don't change jobs either when the government changes, and it's those people who are ultimately responsible for managing some of these grants, and so we've really been trying to help develop those systems.
Hi, thanks for your inspirational presentation. Thanks. So I wanted to hear more on your experience in working for women's health projects.
Oh,
So if you could share more on that.
Sure. We have fairly big projects on women's health, and I can give a whole talk on it if you want to. We don't have time, it's been the pillar of our work in many of the countries where we work, but we're not very well known for it. But I think that HIND is really making strides at making big change in Lesotho, and hopefully we'll be able to use that to change policy. In Haiti, in every single country where we work in Africa and in Haiti, the maternal mortality rates are horrifying, and it's mainly because women don't have access to safe services and to hospital services. And it's always incredibly ironic to me that when I give a talk in the United States, we spend so much of our time with maternity care here talking about home births and being able to give birth wherever you want, and we're just literally dragging women to the hospitals in places like Malawi and Lesotho, okay, not literally, but trying to encourage them to go, because if there's a complication, there's the only place you're going to be able to deal with it is in a hospital. Same here. You cannot do a C-section at home. And so when you get to a point where everyone has access to those services, then you can kind of come back and do the home services. That's fine. But right now, we're really focusing on so that women have access to services both at a community level, a health center level, and a hospital level. And it's that hospital level that's been left out of the equation for maternal mortality reduction since I've been working in the field, which is now close to 25 years. And finally, people are coming around to the fact that, in fact, you really need trained professionals to deal with this problem and to have women help women have safe deliveries. But we're also really moving PIH into a much broader sort of women's health over the lifetime. So we're doing a lot of chronic disease work. We're doing a lot of also just general reproductive health work, and it's a whole spectrum. Anybody else? You get a show. I'm sure there's books written about this, so I'm sure there's a few people who know better than I do. But I think, there's no question that no one that I highlighted in this film has been able to do everything by themselves, right? So I think those couple things that I highlighted at the end about making sure you know, you follow good leaders and you take, you know, learn from them about how they've been able to, you know, implement their big ideas, but also surrounding yourself with friends and family and, you know, colleagues and whoever else you can to really, and understanding that it takes these different pieces to make things work, and that planning actually is a good thing. You know, we tend to, you know, we haven't been the best planners and partners in health our whole existence, but you know, really thinking about what do you need to get it started, and then it can help catch on. I think part of the problem is that there's so many people who will tell you it's, you know, it's too expensive, it's too complicated, and you know, you don't have enough money to have that level of impact. So you start small. And I think, you know, you start with a small pilot project. I firmly believe that with the healthcare law that we passed in the country, and now in its implementation, that some of the ideas that we've been implementing in an incredibly small level of Partners in Health in Boston and out on the Navajo Nation will explode. But we have been trying to do this for like 15 years, and everybody said, community health workers in the United States, what do you need them for? But we've shown that outcomes are incredibly better among our, you know, patients with HIV/AIDS, among patients that we've helped with diabetes and such. And so it's you know, the leadership there, Heidi Beffrus is a saint, and she's been trying to move this project forward for, you know, like I said, over a decade. But I think we're finally at a moment where we can have a huge impact if we're able to share this model around the country and really make sure people are getting the care that they need. So start small, but be persistent too. All right. Oh, 1 minute. And then we probably gotta go. Yeah. Okay.
So you mentioned that you started working for Partners in Health right after you finished your nursing degree, and I'm just wondering a couple things. One, have you been able to practice nursing alongside working at Partners in Health, and or how have you incorporated what you learned or those skills that you know? How have you been able to practice nursing and working with women's health?
Sure. So the first thing I tell people when they want to, nurses who want to go into global health, is that you have to practice in the United States before you can be a good nurse in another country. Yeah. But I haven't actually worked as a nurse in any of our countries. So, but I did take a leave. So I started there 12 years ago, but I've only been there 10 because I did take almost 2 years off to work at Mass General in an infectious disease clinic. And then it was after that I came back and was working on a women's health program in Haiti, so I felt like I had a lot better skills and a lot better knowledge to share. And then, I've mostly at this point sort of become somebody who Sheila will bat ideas off about nursing just because I've got another role to play at Partners in Health. But it's been great to, it's been great to have the clinical knowledge in my role. For all the non-leadership positions nurses hold in this country, we're still incredibly respected in this country. I think we're the only profession that consistently scores positively when they rate. It's like nurses and firefighters, right? Or like the two jobs that people have that people really, really appreciate. And so it's given me, it's actually given me, I think, a lot of credibility, like on Capitol Hill, when I'm down there talking to folks, that they know that I understand, but it also has given me the knowledge that I can just spit out, drugs and treatments and things like that. So I'm really happy that I did it. I'm a little sad that I haven't practiced more, but and I don't think I probably will. But I do, I'm really glad that I'm a nurse and that it's been a part of my career.
Thank you.
Yep. All right, once there's no more, thank you all so much again. Have a great afternoon listening and learning from all these other amazing people you're going to be able to talk to, and go out, be leaders, okay?